suicide. Not only the very public suicides of Kate Spade and Anthony Bourdain, but the very recent, in between those two deaths, the CDC report on suicide in this country with the alarming statistics of the increase in 49 out of 50 states, with Nevada being the one that didn't, but already having a high rate. I wanted to also make a reference to depression and the fact that diagnoses of depression have increased rapidly, and the use of antidepressants has increased some 400% since the 1980s. It would seem that we're doing something wrong. Can you, Dr. Gordon, if you begin, what are we doing something wrong, and what do we need to make sense of those numbers?
So first, we have to acknowledge that this is a big problem that we are not addressing. The rates have been going up consistently. That's not news. It's not been news since 1999. And that's tragic, not only for the individuals who are losing their lives to suicide, but for their families, for the community, and for the country as a whole. We, on the one hand, are doing a lot of things right now. We're talking about it more. Those diagnoses going up, as best as we can tell, that's because people are going to their doctors more. And the prescriptions for antidepressants going up, that's because people are getting better treatment. But treatment doesn't always work, and when the base rate of depression goes up and other mental illnesses that are associated with suicide, then deaths by suicide will go up as well. What are we doing wrong? Well, I think one of the most telling things was in the CDC report that was released last week, was the fact that over 50% of those who completed suicide had no known mental health diagnosis. And we know from years of research that if you go in and really look hard at those who have died by suicide, you talk to their family members, you look at their medical records, you find evidence for a mental health condition in over 90%. So that means to me that it's quite likely that the majority of those who complete suicide in the United States, the majority of those 54% have an undiagnosed, untreated mental health condition. And I think that's one of the big things we're doing wrong, is we're not discovering these cases.
So this area is very personal to me because during college I lost a dear friend and sweet mate to suicide, and she had major depression. And so when I think about this, I think about it in two different ways. One is what we need to be doing as friends, as colleagues of people who have these conditions, and that is, don't do what I did, which was say, cheer up, look on the bright side, things like that were totally unhelpful. What you want to do is really express empathy and say, I'm there for you, I'm here for you, I care about you, and help that person get connected to the right help. The second part of this is that it's difficult to find the right help, to find evidence-based treatments for things like depression, and I think that's an area where we're not doing enough to make sure people have access to the therapies that we know work. Evidence-based therapies, cognitive behavioral therapy, dialectical behavioral therapy, different kinds of therapies. And if you also look at the fact that of people who die by suicide, 10% were released from an institutional setting. That could be a psychiatric hospital, a hospital. So there's things we could be doing and follow-up care to make sure that those people have access to the best that we know to make sure we reduce the risk. Right. So I think there's things that we could be doing as the public, as colleagues, friends, family members, teachers. I think there's a role for all of us, and we're doing education in schools around that. And then I think there's a role for the mental health system to step up and do better in terms of reducing risk.